Welcome to the Psychology Club podcast, brought to you by Vicente Martinez High School.
Okay. Good morning. My name is Jerly, and welcome to the Psychology Club podcast. Today we are with Autumn from the Department of Healthcare Services. Welcome, Autumn. Of
Morning. Thank you so much.
course. Our first question is, what is the Children and Youth Behavioral Health Initiative, or CYBHI?
Thanks. That's a great place to start. The Children and Youth Behavioral Health Initiative is a multi-work stream, kind of multi-department, multi-year effort by the state of California to expand access to behavioral health services and supports for children, youth, and families. It's for all California young people ages 0 to 26, and it includes over 20 different programs or activities that are really meant to reshape the mental health and substance use disorder delivery system in California, and to make sure that we are investing in the right kinds of supports so that young people can get the help they need when they need it, where they need it, and from whom they need it. So including workforce strategies and all of that. But it's a large program um, championed by our governor, and it's part of the governor's master plan for kids' mental health.
Yep.
Hi, my name is Kamala. Why was CYBHI created and what problem is it trying to solve?
The CYBHI was created through a statutory effort in 2021. It was really meant to respond to a mounting crisis facing young people in the state of California related to their mental health. Over the last several years, there have been studies conducted with California youth specifically, but also nationwide, that show that young people are experiencing more psychological distress, more thoughts of suicide, more challenges in terms of, their self-esteem, in terms of self-confidence, and loneliness. And some of that was certainly made worse by the public health emergency and the COVID-19 pandemic, when we all had to go home, we weren't in school anymore. But even before that, the impact of climate change and social media and politics and just kind of all of the things that you all know about are really taking a toll on our young people. And so the Children and Youth Behavioral Health Initiative was meant to make sure that we have support available, not just for people with diagnosed mental health conditions or substance use disorders, but really focused on prevention and early intervention and strategies that are proven through science and evidence to work for young people.
Hi, I'm Gabriella. Who can get services through CYBHI?
So, as I mentioned, the program is really for all California youth ages 0 to 25. And there's all kinds of different ways that young people can get support and help. So we have kind of four primary strategies that are a part of the Children and Youth Behavioral Health Initiative. So we focused on home and community-based services. So we have funded various programs that are helping to bring more community-based organizations that are working with youth, like youth drop-in centers or programs that are offered by local community providers, and investing in those evidence-based and community-defined evidence practice programs that will help kind of provide those mental health services and supports in communities, and as well as like in homes. So home visiting programs, particularly for young parents, or new parents, I mean, right? And to help make sure that a child is set up for success in the home and in the community from the beginning. We've also expanded services within kind of the medical sphere. So making sure that we have more behavioral health providers, so more substance use disorder providers, more mental health providers across the state. And knowing that, like when we did our research with young people before we launched all of these initiatives, one of the things that young people told us repeatedly is that, y'all don't necessarily want to talk to a licensed person. You don't necessarily want, that middle-aged, LCSW, licensed clinical social worker. You want somebody your age, right? Somebody who understands your experiences or is closer at least to your age. So part of the investment of the Children and Youth Behavioral Health Initiative through the Department of Healthcare Access and Information is to create a new workforce strategy called Certified Wellness Coaches. And those wellness coaches are people who have worked in the mental health field, but maybe are earlier in their career or have earned an associate's degree or a bachelor's degree, and have experience working with young people. So that they're kind of more that near peer approach. There's also been some investments in terms of high school age peer-to-peer programs where folks your age are being trained to provide mental health counseling and support to peers within your school. So we have a demonstration project in 8 high schools that is really kind of testing how those types of programs can work and to develop some statewide standards. And then we've also provided some tools for like your pediatricians and primary care providers and others to be able to consult with licensed behavioral health providers, because we know that there aren't enough child psychiatrists, for example. So we want to strengthen the workforce that we have, and provide resources and tools for them. The other strategy that we've employed is really around the digital space. And so we have a lot of different programs that are directly available in the digital space for young people to access today. So, for example, there's a program called Take Space to Pause that was launched by the California Department of Public Health. And that program is really about kind of stressors in everyday life and how you can take that moment you need to kind of breathe and practice mindfulness and take space to do what you need to do to be well, in the midst of all of the life stresses that we all have to deal with. So homework stresses, family relationships, peer relationships, romantic relationships, etc. So there's a whole set of tools available for young people that are part of Take Space to Pause. We also launched a suicide campaign called Never a Bother, which is really to help give young people the words that you need to talk about suicide and suicidal ideation with your peers, to understand what happens if you call 988 or text or chat with an emergency crisis line like 988. And then of course we've launched a program that's available right now to every young person in the state of California. There's an app called Saluna that provides direct mental health support. You can download the app on your phone and talk to a trained professional and kind of one of those near peers, one of those coaches, to get on-demand help within 30 minutes for young people ages 13 to 25. And then there's a partner program called Bright Life Kids, which is available for younger kids and parents and caregivers. They're basically similar types of programs. They offer peer communities so you can understand that you're not alone, that there's more people out there who have your kind of experiences. You can also talk to a coach and access a whole host of resources, tools, tips, and multimedia formats on the Saluna app. And then the last space is schools. And we've done a lot to kind of really invest in making sure that there are enough services and supports at school to meet the needs of young people on a day-to-day basis. And happy to go into more detail about that. And we shared over a flyer that has kind of all of these resources that hopefully you can share with your colleagues and your peers in your school community.
Wow. Hi, I'm Naomi. Are there any costs for families or like is it fully covered?
So all of these programs are available at no cost to youth and families. So Saluna is completely free, for example. So is Bright Life Kids. So if you want to get access to that mental health coach, you can do that for free, and you can have as many sessions as you want to. For the school-based services program that we call the CYBHI fee schedule program, not a very exciting name, but that program is really about providing reimbursement to schools. So it's services that are covered by the health plans. So if you're enrolled in Kaiser or Anthem, or you're in the Medi-Cal program through one of these plans, HealthNet, LA Care, like all of the health plans in the state of California that are regulated by the state of California are required to reimburse schools for the services that are being provided to address mental health and substance use disorder concerns in schools. And so we have this program, and that's also free for students. So even if you have a copay, and normally when you go to a mental health clinic or your doctor and you have to pay a copay, there's no copays for this program. So you can get access to services from your school counselor or your school psychologist or a licensed professional at school or in a community-based setting that partners with your school to deliver care. And it's all at no cost, no expenses, no deductibles, no copays, and it's free for families to be able to access those supports.
That sounds amazing. These two questions are kind of a follow-up to to our third question, was how does CYBHI make sure all students have access to support? And since you could have CYBHI up to the age of 25, is it provided at unis, state colleges, community colleges, or trade schools?
Yeah, so the fee schedule program that I was just talking about, that reimbursement program that gives money from the health plans to schools, that's available in all public schools in the state of California. So TK through 12 school districts, that includes high school districts, elementary school districts. It also includes the California community colleges, California State University, and University of California system schools. The other programs that I mentioned, like Saluna, those are available statewide for free to anybody who lives in California, regardless of whether you're in school or not. So for young adults who maybe didn't go to college, they can also access help through the Saluna app by downloading the app or joining from your computer. So it's not necessarily, required to be in school, but we do want to make sure that, there's different types of resources available. So we have the telehealth programs through Saluna and Bright Life Kids. We have the school-based services programs. We have those community-based programs like the youth drop-in centers that we're funding, that anybody, in those age groups can get access to services all across the state of California. And we do have, and I'll drop it in the chat, on our CYBHI website in the state of California, kind of an impact page that shows you in your community all of the different programs that were funded as part of the various CYBHI efforts. So you can kind of look at all of the different community-based organizations and clinics and schools that are getting funding as part of the program.
What impact do you what impact do you hope CYBHI will have in the next 5 to 10 years?
Really want to just make sure that kids are getting help and access to services early and before kind of that point where it becomes a crisis. So we really wanted to expand the array of services and supports and tools that are focused on prevention, that are focused on early intervention. We want to keep kids out of the emergency department because of suicidal ideation or suicide attempts. We want to make sure that kids are, being treated at home when they have conditions that require kind of an intervention. We want to make sure that young people have the language that they need to talk about kind of the emotions and the stress and all of the things that even adults experience on a regular basis. and that there's these programs here to help, give some assurance to young people all across the state that that you're not alone, that there are resources out there that can help you, and that you all know where to go to find those resources, so that people aren't suffering unnecessarily or not having a trusted adult to talk to, or that you're basically have an outlet to make sure that all of your needs can be met, whether that's at home, in your community, at school, or in your doctor's office, or or on your phone through a digital tool.
How can students and families learn more or get involved?
One of the great things about the CYBHI that I should have mentioned already is that for all of these programs we're talking about, we have involved youth and parents and caregivers and youth serving organizations. So all of these programs, Never a Bother, Take Space to Pause, Saluna, the School-Based Services Program, all have input from youth across the state of California in helping to design kind of what these programs are about. But there are still opportunities for folks to participate in kind of co-designing and as we shape these programs as they go into the future. Salina, for example, has an ambassadors program for young people to sign up and actually be one of the brand ambassadors for this free program that helps youth across the state. But the resources are all free and available online. And everything is kind of launched at this point. So you can, I shared over a flyer that you can share with other students at your school. It has QR codes on that flyer that tells you how to access all of the different resources available for students. There's also the CYBHI webpage. You can also ask your school and your school district leadership, how do you get involved? And there's lots of ways that young people can access the services, support the services, help us do outreach, and then just really kind of help strengthen your peer community and the other students at your school.
Wow. I wanted to add something on. I think it's amazing what you guys are doing. Like as teenagers, like we struggle and stuff, and you guys are here to like help us and
Thank you. I'm glad to hear that. And I have my own teenagers. Well, I guess they're not teenagers anymore. My youngest is 20 now, but they were teenagers when we were planning this program. And so I talk to them every day about how do we make this better and what are your ideas? And we love that you all are doing this and interviewing folks and sharing this information because it's really about, word of mouth. And I could tell you all day long that these are great programs, but you telling your friends and your peers and others at your school about all of this work will make such a huge difference in somebody's life, because there might be a kid that you go to school with that is afraid to tell somebody what's going on with them. But knowing that these resources exist can give them a lifeline and some way to reach out. So I think really the work that you all are doing is amazing, and I appreciate the opportunity to be here with you.
Thank you, Autumn, for joining us today. We learned so much about the Children's Youth Behavioral Health Initiative, or the CYBHI. Thank you all for watching. Don't forget to like and subscribe for more great mental health content.